Hello, this is Dr. Hall. We're going to talk about anthropometrics and body composition analysis. And this is of the book American College of Sport Medicine's Resource for the Personal Trainers, specifically Chapter 12, Clients Fitness Assessment. And of this chapter, we're going to focus on the topic, the content of anthropometrics and body composition analysis. This book, these chapters is study material to become certified personal trainer. So let's go for this part. So first, about anthropometric measurements, we these are basic body measurements that tell us about the outside of the body, things we can see or feel. Um, and examples how tall you are, how much you weight, or your body mass index, that is a number based on your weight and your age, the size of your waist and hips, and you can have over there the body composition definition, that is the relative proportion of fat and free and fat-free mass in the body. And uh, why they are useful? Because it's very easy to do. You don't need any like fancy tools in some cases, and can be done with big groups of people. And clients also is very important. They can learn to measure themselves. It's great for keeping track of progress, like weight loss or waist size change. And about body composition analysis, tell us what is inside the body, like how much fat and how much muscle, how much bone, how much water we have, and who it's measuring here is is, is how is measuring this one. Basically, using tools like skinful calipers, body fat scales, water tanks, special X-rays or ultrasound. There's different possibilities of tests that we can use, and these tests need a trainer or a machine, not something people usually do at home. But it's helpful because you will show real change in fat or muscles, even if your weight stays the same. It helps to track how your body changed with exercise or nutrition management. There are healthy fat range that you can see over there in the screen. For men is between 12 and 23%, women 17 and 26% of fat. And an important fact is athletes may have different goals based on their sport. And other important factor in here regarding to this chapter is the body mass index. What is the body mass index? BMI is a simple number that tells us if your weight is right for your age. It helps us check if someone may be underweight, normal, overweight, or obese. And you can calculate it yourself using this formula. This basically you have over there in the screen body mass index between 8 in meter square in metric units. And why this body mass index is useful? It's quick and easy to do. You don't need like a special tools. Uh, it's good for use with many people at once, like school, like online coaching, like um, many groups. It helps spot people how might be at risk of health problems from being overweight. And there's another limitation or disadvantage. Doesn't tell you the difference between fat or muscles. That's one. And some athletes or tall people may get a high body mass index even if they are very healthy. And it doesn't give you like a true picture of your body fat or muscle mass. And other factor in here as disadvantage, it can guess your body fat percentage, but it's not very accurate. Some examples these, like many of you guys in Highlands that are athletes or for example football players were called overweight, but their body mass index don't fit because you have a lot of muscle mass. In here we can observe about the circumference or girth measurements. And these are measurements of how big certain parts of your body are, like waist, hips, like your arms. Uh, and they help they help us to see where the fat is stored on the body. Having more fat around the belly um, can rise your risk for serious health problems like heart disease, high blood pressure, diabetes, early death. So there's another one too that is the waist to hip ratio, WHR, and it compares your waist size to your hip size to see if you are higher health risk. So this is important because we can measure this one in fitness. They help to track fat loss and muscle mass gain in different body areas, and it's good for checking progress during workouts. They can estimate body fat, but they are not as exact as other high-tech methods. And other factor in here is than this part, it can help you basically in other uh, special. You need to you need to use a special tape that doesn't stretch like metal, and the tape should go straight across the body and be snug but not too tight. That's an important factor in here. And you can measure on bare skin if possible, and always take two measurements on average them. If the numbers are very different, take a number three measurement. Well, we have one important content in here in the ACSM book regarding to this topic, that is the waist circumference. And waist circumference means measuring around your waist to see how much fat is stored in your belly area. And it's important because a large waist size means a higher risk for health problems like heart disease, type 2 diabetes, and other problems. And the risk is ever higher if you have a high body mass index combined. So for women, the health risk cutoff are 88 centimeters, and for men are 202 centimeters. And at the smallest part of your waist, you need to do the measure, and usually between your belly button and the bottom uh, of your chest bone. Okay, and well, we have another important that is the hip circumference and waist to hip ratio, and it means measurements around the biggest part of your hips and butts. This helps check your health, just like your waist size. Uh, Bigger hips can actually be good sign, and may lower your risk uh, of hair problems, diabetes, and other ones. But what is waist to hip ratio? And it is stand by was WHR for short. It tells you where your body store fat, more around your belly hips. You can calculate this one. The waist to hip ratio equal waist size between hip size. And why is important? A higher weight hip ratio means more fat around your belly, which increases the risk or diseases. And you can have over there, for example, young adults like you, over 0.95 are in risk, women, and over 0.86 in men. Let's talk about the skinful assessment. The skinful assessment is a way to check body fat by you can observe on the screen, pinching the skin and measure the fat with a special tool called caliper. And why we use it? This is a simple and cheap method. Does make like too much time, can be pretty accurate if done by a well-trained person with a good equipment. And how this work best? Basically, the person measuring must know exactly where and how to pinch. That's a key point. Another one is your caliper. The caliper should be high quality. It may not work well for people who are very overweight or lean. And how accurate is they usually have a small error, about 3 to 4%. For example, if you are set that your body fat is 80%, the real number might be between 14 and 22% because the error about it. And well, eh, other thing good about this is even if you don't calculate exact body fat percent, you can track changes over the time. I didn't add the skinful numbers before and after training helps show if fat is going down, and that's an important part in here. And well, other thing that we need to know before testing, when we practice this, is it doesn't done directly on your skin. Your skin must to be dry and no lotion. Don't do right after exercise, no wet, for example. And if you feel uncomfortable, you can ask for the same sex trainer. That's an important fact. And well, what about this regarding this possibility is about the error. Remembering here, I repeat that the error about 3 to 44%. For example, it says your body fat is 80%. The real number might be between 14 and 22%. Another important fact is tracking. Tracking in here, if you adding up the skinful numbers before and after training helps show if fat is going down. We can see over here the skinful points, the anatomical size for skinful measurements, and the description, standardized description of skinful sites that we're going to practice in lab. What about these guys is there are 10 important points on how to do the skinful measurements. And number one, always measure on the right side. That's important. It's standardized. Find a mark and correct the spot, the body where you will measuring using this mark or grease pencil, and the person measuring use the right hand to hold the tool, the caliper, and the left hand to pinch the skin. And to pinch correctly, you use your thumb and finger and grab just skin and fat, not muscle, and lift the skin gently away from the body while the person stays relaxed. And other important fact is put the caliper across the pinched skin. It should be straight and about 1 centimeter below your finger, and wait 2 or 3 seconds so the caliper um, can settle, and then read the number, usually no nearer than 40.5 millimeters. And open the caliper first before you let go the skinfold with your fingers. And other important fact is measure each spot at least twice, switching between spots instead of doing one stop over and over. And the last one in here is use the average number for each spot and put them into a formula like Jackson-Epolo, the 3-side formula. And another factor in here, well, we're going to see more about the Jackson-Epolo side. Okay, we have in here the Jackson Polo 3-side skinfold formula. Is very popular. It's a method to estimate how much body fat a person has using just 3 skinfold measurements and their age. And what basically spots do, we measure for men, you can observe it on the screen, chest, belly, and thigh. And for women, back of the arm, the triceps, side of the waist, the suprailiac side, and the thigh. So how this going to work? So you're going to use the skinfold caliper to measure fat at the 3 spots. Take the average of each spot, add up the 3 numbers, use a special chart called nonogram to find the body percentage. Basically, it's quick, easy, doesn't need like expensive equipment, and show if your body fat is going up or going down over the time. Well, we have another method in here is the bioelectrical impedance analysis, and it's a simple painless test that tells you how much your body is fat and how much is muscle or lean tissue, and it works by sending tiny electrical current through your body. One important fact in here is fat slow down the current because it doesn't have too much water, but muscle lets the current move fast or faster because it has a lot of water. That's the key point in here. The machine uses this information to estimate how much body is fat and how much is not fat, like muscles, water, and other organs. There's different types of machine with single frequency or multi frequency. This is the difference between this is how expensive is the machine, and the more accurate are bioelectrical impedance analysis equipment with multi-frequency are more accurate. More about this is that they can have error. Usually they are pretty accurate, but the error is about 3.5, 3.5, and well, but the results can change a lot depending of one factor in here, how hydrated you are. So there are some tips and recommendations to attend before using this equipment, and don't eat or drink for 4 hours before test, or don't exercise 12 hours before, or don't drink alcohol 40 hours before, or go to the bedroom 30 minutes before the test. Avoid caffeine is an important factor, or water pills, unless you are prescribed for it, and don't do their test if you are on your period and holding water. That's an important fact. And this one is um, no pain test, no pitching skin. You don't have to take like clothes off like the skinful test or anthropometry, but it's very sensitive to your hydration level. That's the fact in here. Other important fact that we have in our lab is the hydrostatic weighting. Hydrostatic weighting is a way to measure body fat by weighting you underwater, easy like this, and it is called underwater weighting too. And when you go water, your body pushes the water out away, displaces it, and muscle and bones, the fat-free mass, skin because they are heavier than water, and floats. Fat floats because it's lighter than water, and the more you float, the more fat you have. And a machine compares you weighting air and you're weighting underwater. Basically, you weighted air versus you're weighting under the water, and use that to calculate your body fat. Is very accurate. Error usually is 1% to 3.5%, and well, the facts in here as a limitation is that you need to a special tank, and sometimes you will find in here in universities or labs you have to go underwater. It is not easy and comfortable for everyone. And an important fact in here in hydrostatic weighting that is very accurate. That's the fact in here, but it's hard to do it and you need special equipments. Other technique for body composition is ultrasound for body fat testing. And ultrasound is a safe and painless method that use a sound wave to check how much fat is your body. A small device is placed on your skin. It sends a sound wave into your body to measure how deep the fat is. It can see both fat under the skin and deeper fat layers, and basically to measure fat thickness, with that you are going to estimate your body fat percentage. Similar to the skinful testing, but more advantage with high tech. And the good things in here is that it's quick and comfortable, not pinching or getting wet like the other ones. And the machine is portable. You can carry in different facilities. It's very used in gyms, in clinics, in sports settings. But the result can change depending on the tactical skill. And other factor is some machines are better than other, depending on what's expensive. And they're not one standard way to do the test, yes. But ultrasound is is an easy way to check your body fat, but it depends a lot the person doing the test and the quality of the machine. We have another one. This is DEXA, and DEXA is a special body scan that shows how much your body is made of three components: fat, muscles, fossil, and bone mineral content. Is very detailed, accurate, and doctors use it in often is used to check bone strength. And basically, you lie down while a machine sends a low level X-ray through your body and make sure how fat, muscles, and bone you have. This can take a few minutes and doesn't hurt. Here we can have good things and not so good things about this. And it's very accurate. Error is less than 2%. It's fast and easy and tells you about three components: fat, muscles, and bone health. And you don't have to do anything during the test, just lie down. And the limitations is that it's expensive. You usually have to go for a clinical or medical office or university, and sometimes many, I think 99% of the time, is not available in most gyms or fitness centers. And well, with this one we conclude the topic of anthropometric and body composition analysis of chapter 12, called Client Fitness Assessment, of the book American College of Sport Medicine's Resource for Personal Trainer, that is an important study material for the ACSM certified personal trainer.